Sandy. Do you want me to close the door or not? Just do it.
Hi, Sandy.
Ew, don't talk to me. Ugh.
Hi, Eugene. How are you today?
Fine, thanks.
Good morning, class. We're going to get started by talking about blood clots and all that they entail today. Ashley? 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 Blood clots occur when blood clumps and hardens from its liquid form to a solid, otherwise known as coagulation. When a blood clot occurs inside a vessel and remains there, it is referred to as a thrombus. When the clot becomes...
Can you please slow down?
Sure, Eugene.
You're actually taking notes?
When the clot becomes dislodged and travels to other parts of the body, such as the brain, heart, or lungs, the blood clot is then referred to as an embolism. Both thrombi and emboli can be very dangerous as they can block the blood flow and prevent oxidation from occurring to different parts of the body. So prompt treatment is imperative. The treatment for blood clots can come in two different forms. Anticoagulation therapy is first. This has a preventative purpose for discouraging the formation of blood clots to begin with. Thrombolytic therapy is used when blood clots have already formed, and the drugs are then used to break up that blood clot before it becomes dislodged and becomes an embolism. A common type of thrombus is called a DVT. When one of these occurs, there is redness, warmth, and asymmetry, which develops in the extremity.
Let's go! Let's go!
We are nursing students here from UNCC. We're gonna educate you on clotting therapy.
Grab a pen and paper before we begin. You need to take some notes of what you don't understand.
Contact your doctor with questions at the end. You'll be quite an expert before therapy begins.
We all have blood in our arteries and veins. It feeds our muscles, our tissues, and our brains.
Clotting can be good, but it can go wrong. And that is what you'll learn from listening to our song.
Platelets are cell fragments that are found in the blood. They work with other factors that will form a clotting plug.
When you get a cut, you can bleed through your skin. We all know that clotting is beneficial then.
But if you sit still or you fly overseas, your vessels will get cramped and they'll clot behind your knees.
Check for redness, warmth, and asymmetry, cause that's what you'll see with the DVT.
Ambulate and hydrate to increase blood flow, because if you don't, a clot is what you'll throw.
If it gets dislodged, it can travel to your brain. A stroke is what you'll have along with a lot of pain.
We have 3 short hours to give TPA IV, or signs of permanent damage are definitely what you'll see.
Drooling and paralysis aren't any fun. So physical therapy must be begun.
AFib and fake valves can cause your blood to stagnate. Anticoagulation therapy can't wait.
Clots like to travel and they make it to the lungs. That's where they earn the name pulmonary embolism.
If the little clot decides to travel to your heart, it blocks the oxygen and no muscle will infarct.
Coumadin, heparin, and love are not some medications we can give to prevent those clots.
Flavonox and heparin, well, they work right away, but the Coumadin is going to take a few days.
Don't be surprised if you're taking 2 together. We'll discontinue one based on your proper blood levels.
These medications do not come without risk, so sit down and pay attention while we go over the list.
You'll have excessive bleeding from your gums that cut or scrape. The bleeding's hard to stop because it can't coagulate.
Blood can be found in your urine or your stool, so you'll need to call your doctor. Don't play it like a fool.
Don't freak out if this happens to you. Protamine sulfate or vitamin K can be induced.
These reverse effects of medication therapy and return that blood to where you want it to be.
Use a soft bristle brush for your gums and your teeth. No contact sports or other risk for injuries.
Try the sharp corners of your desk and coffee table. Remove throw rugs and other potential dangers.
You know excessive bruising is another side effect, so remember to give yourself a thorough daily check.
Diet must be constant, we don't want to see it change. It can affect lab values that we draw from your veins.
So any major changes, report them right away. We may need to alter your dosage for that day.
Don't take aspirin, herbs, or OTCs. They need to be approved by a group of MDs.
These enhance effects and increase your risks of negative things we pointed out on the list.
Be sure to tell your dentist before starting any work, and carry an alert card in your wallet or your purse.
Now you know the risks and what to do.
Taking as directed is up to you.
Interventions can include encouraging mobility so blood won't stagnate, hydration of the patient, alright, I guess we'll just finish next time. Remember there's a test next Tuesday.
Did you say Tuesday?
Yes, Eugene, Tuesday.
Bye, Eugene.
Bye, Nancy.
Nancy! Wait! Let's be study buddies!
We're going to play the cut right now, and it's going to be a very, very big hit.
No more room in the pan, I cook up rhymes in a bigger pot. On the road, what you figure got? Tricks in my sleeve, you won't believe my story, weed to a bigger plot. Work, sleep off the pages, hop on stages, we're crazy, need to be like a cages. Right, you feel it? Yeah, I'm light skin vanilla, coming at you like a pack of gorillas. Whole planet on 8, understand?